So essentially, that's an idea that is been probably in the back of the Parkinson disease people in the latest years, probably since 2000, because there was evidence that there was obviously prodromal condition accompanying Parkinson disease, and those were very differentiating patients, were patients that have very long prodromal condition that lead finally to PD, and other people that emerge directly with the motor symptoms. So the idea that something could come from, let's say, from the autonomic side or REM sleep behavior disorder from one side and be more associated with the autonomic dysfunction and coming, let's say, from the body, following what is the Brack hypothesis, that is the original hypothesis on the development of pathology in PD. So following, let's say, body first, then maybe or olfactory bulb or the gut. Essentially, those are the two main hypotheses, but in general, the overall autonomic system in the body, and then finally get to the brainstem and then to the brain, and finally lead to the motor manifestation that we all know. And there are some other people that probably instead have directly an abrupt emergence of these kind of symptoms, of the motor symptoms that are directly coming from the brain. So the evidence is coming from the clinical observation, I would say, and the association of the different prodromal phases within each other, so they could understand that probably there are different phenotypes leading to the final Parkinson disease, let's say, symptomatology. And then what is in evidence and is new in evidence has been a lot of work from the Perbergammer group that is based in Denmark, and they have done a lot of different imaging modalities in the gut. There was especially allowing to estimate the amount of dysfunction in the gut that was preceding the development then of Parkinson disease, especially in REM behavior disease patient, and also data from neuropathology that could allow the distinction of two independent distribution of alpha-synuclein pathology. One more brain-centered, especially it seemed to be more amygdala-centered, and another that really proceed from the, let's say, bottom up. And in recent studies, what, for example, we have done was essentially to estimate these in different conditions, prodromals and PD in their, let's say, clinical condition, in the clinical phase of the disease, and staging, having different modalities to stage the pathology at different levels in the brain and in the brainstem, but doing this in vivo, so not, let's say, ex vivo in the neuropathology condition. And this allows us to show that effectively there is a difference between people that emerge directly and abruptly with motor symptoms and people that instead have a long prodromal phase accompanied with autonomic or REM sleep behavior dysfunction.